while we're on this, the hemp CBD topic is coming up, as well as I know it's both from the cannabis family, but cannabis CBD versus hemp CBD. You want to touch up on that? I'm seeing it's coming up a little bit here.
Well, this is a very confusing topic that's not going to get less confusing. It's going to get more confusing before everybody understands it. But currently, what's going on right now, this is different than what's going to be going on a year from now. Right now, the hemp strains that are available are industrial hemp, the stuff that you can make buildings out of. And the cannabis plants are those rose bushy-like things that you could never build a house out of. They're very different plants. Now, probably 50,000 years ago, 100,000 years ago, these were the same plant, and some went and developed more structural fiber plants and some medicinal. So right now we have the fiber hemp plant that has a little bit of CBD and a little bit of other cannabinoids in it. And we have medical cannabis plants that have tons of oil in it. They make much better medicine. Even if the CBD amount was the same, that's not the big deal. The big deal is all the entourage effect, the terpenes we talked about, the flavonoids, the plant lipids, the plant waxes. All these molecules are therapeutic. And the difference isn't the CBD molecule. The difference is all the hundreds of other molecules that are missing from industrial hemp.
Great, thank you for that. I'm going right down here. So I'm trying to get everybody's questions here, so I'm not avoiding you. I know people are asking why aren't you answering my question? I have hundreds of questions here, so I'm just flipping down here and going right down. And a lot of them are duplicates about breast cancer and prostate cancers as well. So let me just see. A lot of questions. And you and I have traveled the country and have spoken at quite a few international integrative oncology conferences, and you've always shared about THCV, but it's really not available yet. And so a lot of people are asking, where does one find THCV? And so we're not hiding it from you, but it's really not available right now, right? I mean, you do have some growers that are working on this right now, but it's a rare strain, just like CBD was a rare strain. 6 years ago, no one knew what CBD was, and now it's the talk of the world.
Well, THCV is definitely much more rare than CBD. I mean, I was very involved with the CBD market thing, and this is much slower. Also, because THCV is a true sativa, and it takes 14 to 16 weeks to flower. So it takes forever to grow these plants. But yeah, no, there are crops now that are finishing, and there can be a lot of THCV products in the next year.
Great,
this is going to explode. It's going to absolutely explode.
Yeah. Here's one here. Do you feel that medical cannabis oil is as good as Rick Simpson oil? They're very different. This is from Vixter.
They're not necessarily different at all. I mean, it depends Rick Simpson, do you want to take that, John?
Go for it. Rick Simpson was a Canadian treating his own skin cancer. His formulation was a high THC then. It's made of naphtha, which is I'm gonna say a type of paint thinner. I think he has saved a lot of people's lives by sharing his knowledge. Corinne and I would not have known what cannabis oil was if it wasn't for Rick Simpson. But over the years, I truly believe that people have improved his recipe and have thrown in different terpenes now, different formulations. It's not a one size fits all. My father-in-law was using 4 parts THC, 1 part CBD with his dosage. He wasn't doing a gram of oil. A gram of oil is about 16 to 17 rice grains. Why they use cannabis, why they use that measurement, I have no idea where that came from. But just give you an example, my father-in-law never exceeded a half a grain of rice. If he would have taken 2 or 3 rice grains, he would have been completely stoned out of his gourd, and he probably wouldn't have eaten. And that's what we really wanted him to eat. And we've had a lot of patients that have taken the gram of oil and just felt really uncomfortable. Rick Simpson's protocol, which has helped a lot of patients, it doesn't say if it's for a 2-year-old child or a 92-year-old cancer patient. It doesn't say if they're 32 pounds or a 400-pound linebacker from the San Francisco 49ers. And so, it's be careful. Cannabis oil in the formulation could be very dangerous for some patients as well. And I don't want to give anybody false hope to say cannabis is the golden ticket and it'll cure everything. I don't use the word cure, I'll say heal, but I'm a fan of, giving it a 1, 2, 3, 4, 5 punch, Western medicine, Eastern medicine, alternative medicines, prayer, whatever you believe in, and so that's my thought on that. I'm personally a fan of 190 proof food grade extract when the extraction methods when making an oil like Rick Simpson oil, full extract cannabis oil. You'll see a lot of people calling it FECO, FECO, which is the acronym for full extract cannabis oil. Did I leave anything out? Do you want to touch up on that?
No, I mean, basically the Rick Simpson oil is THC hash oil, yeah. And so is any extracted oil. It doesn't sound as medical when you call it that way, but all the oils are basically similar.
Ooh, here's one for you here, because I know you are, I'm going to say one of the top experts in this, but what strain or ratio is recommended for myasthenia gravis?
Ooh.
And Dr. Frankel has worked with, and this is from Lauren.
I have 70 patients with myasthenia gravis, and this all started 4 years ago when we first got THCA and we're using it. And the combination of CBD, THCA, and then slowly adding THC helps about 70 to 80% of the myasthenia patients. If they're antibody negative and they have no response to mestinon, the cannabis doesn't seem to work as well. So there's clearly a slightly different, but if for the typical myasthenic who is anticholinesterase antibody positive and they've responded to mestinon, at least 8 out of 10 of them will respond to the combinations of CBD. I would usually start with CBD and THCA at maybe 5 milligrams each 3 times a day is a good starting dose.
Okay. And I'm going to go write down these questions here too. So Kathy's asking, what essential oils work well with our cannabinoid systems or endocannabinoid system? And you want to talk about an endocannabinoid system? I know we've kind of skipped
briefly. I don't know about other essential oils interacting with the endocannabinoid system.
Or terpenes.
Or terpenes and pretty much everything out of the cannabis plant will interact with our endocannabinoid system. The endocannabinoid system is about 1 billion years old. Any animal that has a spine has an endocannabinoid system. And it was developed long before cannabis came onto this planet. So we have this system that has molecules that look very much like THC and CBD. We have receptors for these molecules, and they affect every cell in our body. And we now know that deficiency states of our endocannabinoids, our tone or the levels of our endocannabinoids go down. That is the cause of a number of diseases, including migraines, irritable bowel, fibromyalgia, and a few other illnesses that are very, very, very common and usually are kind of put off by doctors. We think, well, that's a little bit weird for us. We don't know what that is because we don't know, or they don't know that we have an endocannabinoid system. So not knowing that we have an endocannabinoid system, not knowing that it's associated with diseases makes it difficult to diagnose and treat a number of patients. I think it's one of the most fun things I have of having somebody come in with migraines, fibromyalgia, irritable bowel, and boom, you put them on a few milligrams of CBD a few times a day, and in a week they're dramatically better. And what's even more interesting is that after a few weeks, a few months, they need less and less and less of the CBD. I think maybe I'll touch briefly as to why I think that is. I think it's nutrition. And whatever nutrition you have, once you fill up with your reservoir, you need less. So I think that's maybe one of the answers. And the other answer, I believe, is that CBD and THC pump up our internal endocannabinoid system, so we don't need external cannabinoids as much. So that's one of the very cool things I think about how we handle external and internal cannabinoids.
Great. Thank you for that. And I'm mispronouncing the name. I want to say Curry is asking, would 1 gram of RSO oil rectally be good dosage for stage 4 lung cancer patient? And should she be ingesting it some orally too? So
for that patient, if it was all in the lung, I would do everything by vaping.
Everything
directly, yeah. If all the tumors in the lung, why not put all the medicine right past the lung?
Yeah. Okay. And then we have a lot of patients asking, a lot of our listeners this evening asking, when you say wellness dose, what is that exactly? The quantity and ratio. Another one is asking, I didn't hear the amounts of THC to CBD for keeping cancer in remission. Mine's cervical. So
well, as far as a wellness dose in general, people come in and ask, if I was going to take some CBD to help protect my brain and my heart, and I usually give them 15 milligrams at night. I mean, it's not magic. That's just the number I pick. And I think part of the reason I pick these numbers is I've had 12 years of experience with these things. And when you treat a whole bunch, I mean, hundreds of different illnesses, as opposed to just treating one illness with cannabis, you start getting an idea of what works at what dose. So, I mean, the whole cancer thing and saying we're using these 4 oils, over and over again, the change, as far as I'm concerned, will be when we have a 5th one to add to it. And it's in chemotherapy and immunotherapy is not all that much different. Certainly, it's not like if we knew one treatment that worked, that's what we would do 100% of the time. But the reason we combine treatments or combine cannabinoids, combine chemotherapy is because we don't.
That same person as vaping scares me as it's in the lungs, which I agree, and that's where I was with my father-in-law back in 2011. You are seeing good results with this. What do you recommend she vape? She's never vaped before. I
would start with just, it's important to try get the location of a good place that's using, clean oil. But I would
all let's go into testing here. So if the product hasn't been tested, if you're in a legal state or you're in an illegal state and you have access to legal state material and however you're getting it, more power to you. So I'm not advising you to break the law, but if it was my wife, I would travel around the world to get it. But make sure it's tested. There are top companies that are testing for molds and pesticides and fecal matter, metals, different toxins. So your body is already compromised with a low immune system. So you're putting this into your body. So be aware of what you're putting in your body. So if a company that you're working with has not tested their products or the test results are 6 months or older, go to another company that has more accurate and more up-to-date products that have been tested. And I cut you off, Dr. Frankel. I want to, we haven't talked about testing, but I want to talk about safe medicine, really.
Yeah, I mean, I really don't recommend medicine that I don't have the test results on. I mean, I just don't.
Yeah. So I'm reading the back thing. So vaporization with lung, do you recommend them doing a volcano, or do you use, and a volcano is getting the cannabis plant, the bud, grinding it up and putting it into a vaporizer, and those type of vaporizers. And then they also have the e-cigs that you see very similar to a pen that people can smoke as well. So what do you recommend? The oils, vaporizing the oils, or vaporizing
the volcano? I mean, I love the volcano. The problem is who's going to find CBD bud to vape in a volcano? So as a practical matter, it ends up being CBD oil.
Okay, thank you for that. Claire's asking, I read that CBD is contradicted with Taxol. It enhances the effects of Taxol. Is this true? And can you talk about drug-to-drug interactions as well, about cannabis? And so if you're on any medications, be aware that cannabis can intensify that medication. Sometimes in a good way where you can lower your dose while using cannabis as well.
I mean, Taxol, I've treated a lot of patients with breast cancer getting Taxol and other malignancies. I have never heard of there being any particular issue with Taxol and cannabis. I need to see what they're talking about. And
okay.
reference.
Janet, would cannabis help with severe bone pain caused by taking the estrogen blocker anastrozole?
Yeah.
And I am familiar with that product. If so, CBD or THC?
CBD.
Okay, that was for Janet. So hopefully you're still on here. Sorry, everyone here. So Clark's asking, are there products with all 4 cannabinoids available in California? And I think the four cannabinoids that you're talking about is THC, THCA, CBD, and CBDA, and that's what you're taking right now, correct? Is that you were talking about four products?
Yeah, and even if we work with patients in a lot of different states, and they'll get oils and syringes or shatter in dispensaries. They don't know that it's most of them don't know that that's THCA, but THCA in oil form is called shatter, and most dispensaries have shatter because it's a way to smoke oil. So you can get that, and then I help my patients over the phone to mix up their shatter, their THCA. CBDA is usually tougher, so our compromise with most of the out-of-state patients are CBD, THC, and THCA. And there's a number of ways of getting it in many states. I often say, the old saying, where there's a will, there's a way. You can do it.
Yes. And people are writing notes, and I'm just picking up. Let me see. I don't know what this one here, and it's Maria. Can you give the pharma name? Oh, I know the pharma name probably of Marinol, Dronabinol.
Dronabinol, yeah.
Can you give the pharma name in the chat box, please? Thank you. So you want to answer
Dronabinol.
that? Dronabinol. Okay, and boom. And then we had, what are the acid molecules? So the acid molecules, again, that was for CJ Heng. And that was THCA or CBDA. And Jane's asking, what is the best cannabis for breast cancer? And so breast cancer is different. I mean, there's so many different types of breast cancers, and each breast cancer is treated differently. So if you want to ask that question again, Jane. And Dorley is asking, can you repeat the name of the place in Holland for European patients?
Bedrocan.
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 You spell it?
B as in boy, E, D as in dog, R-O-C-A-N.
Great, thank you. And that was for Dorley there. So Victor is saying, I have a liver tumor and have been using nightly 200 milligrams of THC cannabis suppositories. Is this a good choice for liver tumor?
Well, that wouldn't be something that I would recommend. I would rather see you take some CBD with it and take it orally at a lower dose. Again, because rectal absorption is just not reliable.
Gotcha. And liver is the only organ that can reproduce itself too. Thoughts on that?
Well, certainly, I get asked a number of times if cannabis is harmful to the liver, and I think what they're hearing is about drug interactions with the P450 system in the liver, and that somehow cannabis is hard on the liver. But it's not hard on the liver. Whole plant cannabis, as a matter of fact, this is one of the big advantages of sticking with whole plant cannabis as opposed to single molecules. CBD, as part of the whole plant, when it's absorbed and goes to the liver, it actually signals the liver to increase the number of P450 enzymes needed to be made. So whole plant is very safe in large dose with regard to the liver.
And did I cut you off when we were talking about hemp CBD versus cannabis CBD, and I think we went into testing, or did you finish that?
I think we finished it.
Okay, so Pam is asking, what is your recommendation for estrogen receptor positive stage 4 serous carcinomas?
Serous carcinomas?
Serous carcinomas.
Yeah, again, like I keep saying, I until we know that there's a better regimen to use, we are using equal amounts of those 4 cannabinoids at 30 milligrams each per day for a total of 120 milligrams.
Joanna is asking if juicing the leaf, how much, and does it matter what strain of the plant? Great question.
Well, if it needs to be a THC plant, it doesn't really matter whether it's a sativa or indica or the strain. Leaves themselves, you need to have hundreds of leaves to get enough of a dose. So I would really try get some buds, in there. Or use a half a gram a day of a bud. That will give you enough THCA for cancer, in my opinion.
Great, thank you. And for the people out there that are growing their cannabis legally, I'll say, and if you want to juice, you can juice it and then put them in ice trays and keep them in your freezer that way. And then, every day you can take one ice tray, one ice cube or 2 ice cubes or 3, however you like, and put it in your smoothie and go that way. And that way you're not wasting anything like you would have, a head of lettuce in your refrigerator and, 5-6 days later it's wilted and you have to throw it away. So if you have fresh leaves, juice them and put them in ice trays. And we found success that way. Question that Lotus is asking, and Lotus is a regular from our pain master class. So Lotus, I hope you join us for our cancer master class. And Lotus, I believe, is up in Canada, if my memory is still sharp there. But they're asking, when you juice cannabis, do you put it in a Vitamix blender or a juicer? I would say juicer. And can you talk about the blades in a Vitamix or any other type of blender that conducts heat, and they kind of will that change anything?
Yeah, I mean, if you like with the bud, that I have patients grind it up, but they're going to use like a half a gram of bud a day to get their THCA. I always have them grind it with their fingers because the blades can heat it up, and then it would decarboxylate it into active THC. With leaves, you figure you're probably getting a half a milligram per leaf. And you can easily get a couple hundred milligrams from a gram of bud. So that's a very, very, very rough way of thinking about it.
So a lot of questions are coming in about THCA. So Diane's asking, so is juicing fresh grown cannabis the only way to get THCA and CBDA? So yes and no. The no part is there are a lot of companies now that are making sublingual tinctures of THCA and CBDA infused in MCT oil, coconut oil, grapeseed oil, olive oil. And I'm more a fan of those type of tinctures over an alcohol based due to burning. A lot of people don't like the taste. And then you want to talk about oils opening up receptors?
Oils?
Like coconut oil open up receptors or fatty oils?
We use MCT oil specifically because it helps open up pathways for absorption. Yep. And also it has a lot of healing properties, anti-seizure properties. It tastes sweeter, and coconut oil just gets too thick below 70 degrees.
Gotcha.
And I agree about alcohol.
Sorry?
I agree about avoiding alcohol.
Avoiding alcohol. Joanna's asking, can you juice previously frozen leaves?
Yes.
And what would you recommend? Putting that in a smoothie, or what would you say?
Yeah, a smoothie, and just I can't remember the names of the different grinders, but the ones that are more pulpy rather than turning it into, like you can put an orange in and have it keep the pulp. That's much healthier for cancer than turning it into a sweet juice.
Gotcha.
I think the blender is the right one, I think.
Yeah. I'll think of the blender here. That's best for juicing here. So give me a second. I'll let my mind catch up here. Can just a CBD alone be effective at helping lung cancer? And so THC has been proven to kill cancer cells while CBD stops the spread. So a formulation of the two is wonderful. It's also called the entourage effect. If you want to do some Googling on the entourage effect, why they work together. It's like baking a cake and leaving out the eggs or the flour. I truly believe that these two go together, and with other different cannabinoids and terpenes as well. So I hope that helps your question there. And I'm going right down. Doe Bucky is saying, so if I take cannabis oil orally for stage 4 cervical cancer, am I wasting my time?
If I take what orally?
Take cannabis orally for stage 4 cervical cancer, am I wasting my time?
No, not at all. I've treated a lot of patients with cervical cancer orally. As far as like the local treatments, give us 6 months. I think we're getting closer on it.
Okay. Connie's asking a great question. How do you choose the particular CBD, THC, THC, and CBDA at a dispensary? So I do recommend meeting with a medical professional who knows about dosing. I think there's a lot of information in dispensaries, but I think going in there educated, a lot of times they're just, for the true sick patient, I think you best to meet with a doctor who knows what they're talking about. If you can't make it to a legal state, you can always do a consultation with Dr. Frankel via phone or video. Your doctor is more than welcome to sit in on the call, so he or she can learn and be up to date. And I think education and getting the information out is a must, and that's what we do here at the Sacred Plant, is get this information out to patients, families, and their doctors. So I think the ripple effect is what is needed to get this information out. Let me see. Rebecca's asking, why don't they inject into human tumors?
Well, that has been done with some success, and I'm sure there'll be more studies on that. Dr. Guzman in Spain did a lot of work on that, but then went to more systemic treatment. I'm not sure why. It's questionable why.
Susan, yes, it is called a Norwalk, Susan. So it's a Norwalk blender is probably the best. They are expensive though, so you might want to, if you are going to do that, might go to Craigslist, see if someone's using or selling a used one to get half price or something. And I know Thanksgiving's coming up, so you might find one of those on Amazon, with a Black Friday sale. Let me see here. So Floris, my question was skipped. Sorry, Floris. What's your advice for a 38-year-old male with stage 4 melanoma and metastasis to the brain, intestines, and liver?
Oh, I think that's complicated for me to want to.
It is, because it's cannabis is.
There's so many issues with a patient like that they need to know more.
One, you look at age of the patient. I know 38 years old, weight, current health condition, the type of ailment that you're going after, and then any type of medications that you're on too need to be looked at. Cannabis is not a one size fits all.
Plus, there's a lot of details to this. Can you imagine calling a doctor up and asking for the dose of chemo to give their family member? I mean, we're looking for the same type of results. So it's very difficult to say this is a number for everybody, no matter what. And even when I start multiple people in the same way, as I'm following them on a week-to-week basis, it changes all the time. So we need more doctors doing this and people seeing doctors and working with doctors. Because cannabis came from a recreational end, it's kind of staying, I think, too much in the recreational end because not enough doctors are doing this. Yeah. But that's certainly my pet thing. We need to have more doctors trained to be able to work with patients.
And for anybody that is a medical expert, or you're working with your doctor that wants information, Dr. Frankel does have doctors currently mirroring him in his practice to learn about dosing and formulations and different types of ailments and diseases as well. So, if that interests you, let us know. We can set you up here. And I'm reading both sides of the questions here. They're coming in pretty rapidly here. Joanna's asking, what is the best dosing and combo for stomach cancer?
Is this an Asian patient?
One more time, sorry.
Asian patient?
Asian patient, I don't know.
Oh. I don't think we're treating, I haven't seen very many stomach cancer patients, so I've had limited experience with them. You know, that's what I really need to think about and look up a bit more. I don't want to just
Okay.
out off.
Okay. So tonight's thing also is for, you know, informational purposes only. You know, I do recommend consulting with a doctor. Dr. Frankel is who I'd recommend as well. So let me see here. Anonymous is asking, should a dose be taken over intervals, or is it okay to take full doses for the full day all at once?
I strongly recommend dividing to 3 doses.
Great question, by the way, too. Flores is asking, can you recommend any doctors in Holland?
I would ask Bedrocan. They should know.
Okay, great.
But I mean, yeah, I mean, actually I should check with Bedrocan too.
Yeah. Yep. Someone's asking, are any doctors in Canada mirroring you, Dr. Frankel? Not yet, but send them down, Victor.
Yeah.
So Karen is asking, as a doctor, I'm interested in mirroring Dr. Frankel. Wonderful. So if you want to get a hold of us, I'll get all everyone's asking. I'll be sending out contact information before the show's over as well. Karen's like, how do I start mirroring Dr. Frankel? So we'll get that in there. Let me see. What about nurses? Come on down. He works with nurses as well. Let me see here. I'm gonna get some more cancer questions here. Great one. I do see your question. I'm interested. I'm an internist, infectious disease MD, and interested in learning of with Dr. Frankel. Can you? So we have quite a few of these here for you, Dr. Frankel. Anonymous, I have horrid chemo rash on my whole lower half of my body. What type of cannabis should I use for this, and the amounts? So I'm assuming this is a topical.
So they said chemo rash?
Chemo rash. I have horrid chemo rash on my whole lower half of the body. What type of cancer should I use?
What type of cannabis you mean?
Excuse me. What type of cannabis should I use?
What type of chemo are they getting?
It just says chemo rash.
I would use topical CBD.
Yeah. Yeah. So we have a lot of questions here. What about working with pharmacists? Yes, Lisa. You know, I'm a big fan of pharmacists. You know, our company, United Patients Group, is what Corinne and I formed back in 2011, and we're leader of education and information, and we pride ourselves on educating not only doctors, nurses, but pharmacists. And we were the first cannabis company to partner with a pharmacy school here in California. We were the first cannabis company to partner with the California State University for education. We've been in Utah twice. We were the first cannabis company to be invited to the U.S. Capitol in Washington, D.C., May of 2017. And we did a day of education for bipartisan. We had people from Congress and Senate, as well as news outlets there, and it was our event. It wasn't just an open mic, and it was they welcomed us with open arms. So this topic of conversation is getting out there. The buzz is getting out there for doctors and our governments wanting to do the right thing in helping patients. Like I said, cannabis or cancer does not discriminate. Can take down the healthiest person in the world. It doesn't matter how old you are, where you're from, your background. This is an ugly thing. So education, and this is why we do this. We want to educate and help. So someone's asking, any recommendation on contacts in Australia to work with cannabis?
No, I mean, Australia and New Zealand are really kind of moving backwards.
Yeah. Are they? Yeah, we used to work a lot hand in hand. Actually, Corinne and I, we spoke at New Zealand Parliament probably about 4 years ago, and really haven't heard much with New Zealand and Australia.
I was getting involved with New Zealand and Australia, and then it's disappeared.
Yeah. Someone's asking, where does Dr. Frankel practice? He practices down in Santa Monica, California. So Jennifer, here's a question from Jennifer that just came in here. Any help on pancreatic cancer dosing as well as amounts? And so
the pancreatic cancer patients, I must say, they're some of the ones we've been having the best responses, which is shocking over the last 2.5 years since we added the acid molecules.
Wow.
And again, I mean, I'm sure Rick Simpson would be giving the gram a day. I right now would, until we have more information, I would use the 30 milligrams of each of the 4 cannabinoids that we've been talking about.
Perfect question here. What are the differences between sativa and indica, THC, and CBD?
Well, I don't believe that sativa, with rare exceptions like the THCV, but for the CBD plants out there and the THC plants out there, sativa and indica very rarely mean anything any longer. The plants have been so bred together that, I mean, trying to get a predictable effect from a sativa versus an indica, I mean, the classic thing, of course, is indicas in the couch and be more sedating, and sativa is more uplifting. But I practiced for 5 years using those rules, and they just fell apart. Yeah. And I think we need to do everything based upon what's in the plant, the cannabinoid levels, and it's all milligrams of medicine.
Great, thank you. And here's a question I lost. It's from Lauren. I was just diagnosed in June with MDS with MPN overlap. I don't know what those are. Maybe you will as a doctor. So I was just diagnosed in June with MDS, Michael David Sam, with MPN, Michael Paul November overlap. I've been taking hemp oil, but I live in a medical marijuana state. How would you suggest I begin with cannabis treatment?
I would need to study that. I mean, I haven't seen enough patients like that, if any. So I would need to look that up.
Okay. And would you recommend, if someone's living in a legal medical cannabis state, would you have them continue with hemp, or would you have them try? No,
I would for sure go with whole plant cannabis.
Maintenance dose. I'm going right down these questions, ladies and gentlemen, here. Sorry. Here's from Canary. Want to keep my body as healthy as possible fighting this cancer on 2 kinds of chemo. And is it Neulasta, Neulasta?
Yeah.
Have 1 round to go. How could CBD, THC help me with the fight? And what is the ratio for THC, CBD, Dr. Frankel? And my heart goes out to you, John, for your loss of your wife. Thank you, Canary.
Well, Neulasta is a drug to help increase your white count.
Neulasta, excuse me.
Neulasta, yeah. And I would use, again, 1-to-1 CBD, THC.
Okay. Let me see here. All-Star CNY. I have mesothelioma for the 2nd time. Total commitment to non-traditional therapies. Total commitment to non-traditional therapies. I have oil, but I'm questioning the administration, considering suppositories made with chocolate. Thoughts? I don't know any suppositories made with chocolate, but you want to touch on mesothelioma? Actually, there's a good friend of ours now. They came to Corinne and I probably about 7 years ago, and her father was battling mesothelioma, and they gave him weeks to live, and he was on a 4-to-1 ratio, 4 parts THC, 1 part CBD, and he's still alive, doing extremely well. And that was an extreme case of mesothelioma. I don't know if you had any patients like that as well.
No, also haven't done any chocolate suppositories.
Yeah, maybe they're asking considering suppositories or chocolates, but it just says it says considering suppositories made with chocolate. Thought. So I don't know that one. So is there any benefit in using cannabis when in remission with stage 4 bladder cancer? If so, how much? I know you've touched up on that question earlier.
I'd be the same answer. I mean, I would probably, if they're in full remission, I'd probably be using something like 60 to 80 milligrams divided between those 4 major cannabinoids.
And so Canary, this is one I was chuckling at earlier and I couldn't find it. Dr. Frankel, I named my tumor in my breast Yoda. So, when we were going through this with Corinne, we never said the C word, it was, excuse my language, we called it shit or crap. So, don't give any attention to cancer, fight that, kill it, get rid of it. So that's what we did. So Canary, I think is great that you name the tumor in your breast Yoda. Here we go. Also, this is from Lisa. Also, have you ever heard of taking CBD dominant and THC dominant doses separately during the day to treat cancers?
I don't know what they mean by CBD dominant and THC dominant.
Probably just straight CBD and straight THC and doing it separate times compared to taking an oil that
I always believe in taking them together.
Always taking them together, okay.
CBD and THC?
Yes, because I've heard that's what we did. We took them together. We did it with my father-in-law as well. But I do hear some patients out there and other oil makers talking about, take the CBD at this time, take THC at this time.
Well, we talked about that earlier. And the reason I feel strongly against that is the effects of these cannabinoids are working at the same time. So if you spread them out by, again, I understand why people do it, so they can take the THC at night and the CBD during the day.
Yeah.
I understand the logic, but I think you're losing a tremendous amount of activity by doing that.
Gotcha. Heidi's asking, is there a way to treat people with cancer without them getting so high or passing out from the THC?
I treat patients every day, and we gingerly treat them. We've not had anybody pass out.
And the goal is not to be high. So THC, I don't want people to be afraid of THC, and I hear this on a lot of media stations, on radio stations, on articles where they're saying CBD is a medical portion of the plant and THC is the recreational or the bad portion of the plant. And that's completely false. It's all incredible medicine. The goal is not to be how high or how stoned you are. The goal is to get healthy, of course. And it's like wine. You can have a sip of wine and not feel anything, or you can have 3 bottles of wine and you'll be drunk off your butt, I'll say. Little doses of THC aren't bad. So I don't want people to be afraid of THC. I think
also in cancer, it's critical. I mean, it's incredibly important. It's like saying, I'll take half of my chemo, but not the other.
Yeah. So here's one from Margot Young. What type of cannabis is good for IPMN, an IPMN cyst on the pancreas?
I'm sorry, I have no idea.
IP is India, Paul, Michael, Nancy cyst.
I just don't know. I'm not familiar with that particular cyst. Okay. So and if it's benign, cyst, we really don't know about much effects of cannabis on benign tumors.
Okay. Here's one from Anonymous. My sister died from cervical cancer, which had spread. Would cannabis have helped her at all? If my cancer, she's in remission, were to reoccur, would it help me?
I mean, I already take these 4 molecules every day for prevention.
Yeah.
So I think in this case, I wouldn't wait. I would do it now. If I believed it worked and you can get it, what's the argument for not taking it?
Yeah, yeah. And so people are asking, can you repeat the 4 cannabinoids you're taking right now? So THC, THCA, CBD, as well as CBDA. And you're saying 30 milligrams a day, or what were you saying?
30 milligrams a day of each for the active treatment.
Gotcha. And so do you take the 30 milligrams, I'm assuming the 30 milligrams of THC, which will be psychoactive at nighttime? A lot of patients do that at nighttime before bed.
This is 30 milligrams over the day. So it's 10 milligrams 3 times a day.
But you will still feel something. If you drive, I wouldn't recommend it.
Right. But
okay.
I would never start somebody at that dose. We start them at 1 milligram of each 3 times a day, and then 2 milligrams and slowly get up to 10 milligrams each.
Gotcha. Thanks for that. And Cheryl has a question here. What do you suggest for a person with prostate cancer that had mets to the bladder wall, very small site in the pelvic bone, and one lymph node? He has been taking cannabis tea every day and has done very well until recently. PSA has slowly been climbing up.
Well, first of all, for prostate cancer in general, there are the hormonal manipulations. So just because somebody's using cannabis, I would strongly keep an open mind on the anti-testosterone therapies. Yeah. And for the prostate cancer, I would take it systemically. And I promise I will write an article. If we can prove that the rectal stuff is working, I will be writing a lot about it.
Gotcha. Thank you. And here's one here from Deborah and Larry. Dosing for early stage prostate cancer, are suppositories the way to go?
I don't think so.
Yeah. What would you do for dosing for early stage prostate cancer?
I would use the same. I mean, it's the thing is there isn't an answer for all early stage prostate cancers. It'd be like calling an oncologist and saying, what would you treat for this? Or it depends upon a lot of issues, the age, hormonal stuff, whether they required surgery, did they get any radiation? And I can think of 10 other questions before they can certainly send an email to our office and we can try and answer it better. But
gotcha. Here's one here. Is cannabis successful with uterine serous papillary cancer, stage 3? I recently completed chemo. So what would you recommend with that?
I would recommend the same. I would recommend them using it. If they're cancer free and they're definitely in remission, I would use somewhere in the 60 to 80 milligram range. And if they weren't, it'd be close to 120. But one of the other things I do change is the amount of THCA. If somebody's not doing well, and particularly if they have an intra-abdominal pelvic tumor, I will add more THCA. And that's often in the form of buds and juicing.
Okay. Here's one. My wife is stage 4 breast cancer patient, with low volume spots in eyes, some lymph nodes, lungs, and her bones of her spine, and hips. It's estrogen fed. She's trying oils of various amounts of THC and CBD, but we feel lost and we don't have guidance. What should we do?
I'm sorry. I thought this was the timing. I skipped something with my children, so I just have to check on it.
I'll repeat the question one more time, doctor.
Thank you. Sorry.
My wife is a stage 4 breast cancer patient with low volume spots in eyes, some lymph nodes, lungs, and in her bones of her spine and hips. It's estrogen fed. She is trying oils of various amounts of THC and CBD, but we feel lost and don't have any guidance. What would you recommend on that?
That's a very typical case that I would use capsules that would give you a total of 120 milligrams a day. That's my magic number for now.
Of
the four.
Of those 4. Okay.
Yeah.
Katrina is, I battled cervical cancer this past year. PET scans show lymph node involvement. I took FICO and CBD along with plant-based nutrition. NED as of last month. Well, it was caused by HPV. What do you recommend for maintenance dose? I also have severe Crohn's and don't want to get back on an immune suppressants.
Well, we're starting to talk about 2 major diseases at the same time over a video. It's difficult. By the way, there's good new data with Crohn's and THCA. So this is somebody I would use capsules of the 4 cannabinoids. I mean, I would. I wish we had something smarter to say with each one of these questions, but this is the best combination that I think we can come up with right at this moment.
Great, thank you.
I just hate to be so repetitious, but it's
is repetitious. This is from Yulia, and good evening. Welcome back. Welcome, Yulia. I was diagnosed with invasive ductal carcinoma, ER/PR HER2 stage 1, and now have a lumpectomy as only treatment and 6-month follow-ups. What is the dose for prevention for someone with cancer history? Thank you in advance.
I'd probably take something like 15 milligrams of each of the 4 a day, like a half dose. 15 milligrams of CBD a day, 15 milligrams of THC a day, 15 milligrams of the 2 acid molecules.
Great, great. This is from Cherie Huff. Hello, Cherie. My 74-year-old mom has stage 4 breast cancer, and what would you recommend? What's the best way to introduce this to her? She has not been open to this the first time. I'm definitely concerned for her health. Breast cancer came back much worse. She's trying to be more open to this, this time, I guess, to medical cannabis.
Yeah, I mean, this is something that's going to have to be started a milligram at a time. Otherwise, she'll get very uncomfortable and will quit.
Yeah.
So it's, again, this is something, a phone call, I could talk an hour about this.
Okay. No, you said midnight. We're going to midnight, my friend. We're going midnight.
I just didn't know I had.
I know you have
feeling on my kids right now.
I know you have the kids in town for Thanksgiving, so let me do a few more here, and then we'll go on here. Let me see here. This is from Lorinda. What would you recommend for treating? Sorry, my eyes are getting bad here. You can tell they're bloodshot. Is it peritoneal?
Peritoneal.
I am currently using fecal oil, and I'm using half a gram at bedtime. I am using the Rick Simpson protocol, but I'm not sure if I'm doing the right thing. My CA 125 is starting to go down, and the SUV on the PET scan is also going down.
Well, I guess it'd be the same answer that, I mean, whole plant oil I'm a big fan of, which is to me the same as FECO, but I would use a dose closer to 120 milligrams, and I would spread it amongst those 4 cannabinoids. These are 4, the reason I do this, I know I'm repeating myself, but it's because it's the most we know. You know, it's the most honest answer I can give. And also, why not why stick with a high THC program when we have CBD and other molecules? I mean, the acid molecules have been proven to kill cancer cells. I mean, it effectively. So why wouldn't we add them in when they help so much with nausea and discomfort in so many other areas? So I don't see the reason to use high dose THC and ignore everything else. We know way too much to just be using high dose THC, I believe.
Excuse me here. The question about the chocolate came up here, and the suppository question was chocolate likely refers to making suppositories with cacao butter for consistency. Yes. Oh,
yeah. Well, yeah. Cocoa butter is good for that.
Yeah. Ralph Curtis is asking, will CBD THC heal bile duct cancer? If so, what dosage?
Bile duct cancer, cholangiocarcinomas, and pancreatic cancers are pretty much the same tumor, very similar cancers, and they're often misdiagnosed as one because they're in the same area and both present with jaundice, and both respond amazingly well to THC acid. So that's the biliary carcinomas is one of the situations where I would give people an extra gram or so of THCA,
which is non-psychoactive.
Which is totally non-psychoactive. Yeah.
Scott is asking, I have a papillary carcinoma of the thyroid. It's growing. Had it for years. What would you recommend?
Remove it.
Remove it?
Yeah. Because papillary carcinomas of the thyroid are supposed to be the most benign, but if they spread, if they get aggressive, they can be pretty terrible.
Yeah.
I would, if it's possible to remove it, I would have it removed.
Okay. Here we go. Here, this is from Flourish. I'm here for a good friend who has melanoma with metastasis to the. Sorry, here. I'm here for a good friend who has melanoma with metastasis to many parts, including her brain. She has 20 plus aggressively growing tumors in her brain. She had various types of immunotherapy, and the last one caused her to have intestine infection that is preventing her from continuing the treatment. She was told it could be weeks. Do you think CBD or THC could be beneficial in extending her life?
Well, first of all, I think telling somebody that they have weeks to live is never the right thing to do. And they're very, very rarely, once they say that, they're usually wrong. So I would, for this patient and their family, I would say, don't listen to that. Assume you're going to be living a long time. The second part of your question, absolutely, I would use, cannabis.
Yeah. I mean, we were given weeks to live. I say 2 weeks. My mother-in-law says that the doctor said 3 weeks, or weeks, I should say. But don't give up. I mean, my father-in-law is a perfect example of us not giving up, and he's still with us, and that was 2011. And knock on wood, all of his scans have come back with no evidence of recurrent disease. So Flores, sending you hugs, blessings, and prayers for your friend there too. So, Juan is asking, a 57-year-old girlfriend with a 0.7 centimeter invasive breast cancer removed, borders plus for DCIS, declining, suggestions for this? Do you have any suggestions for?
I'm so sorry. My kids are phoning me. I'm sorry. Could you read the first part of it again?
Last time, doctor.
Okay.
So this is from Juan, 57-year-old girlfriend had 0.7 centimeter invasive breast cancer removed, borders plus for DCIS, and it's declining. Suggestions for this? Any prescription for that or recommendation?
Yeah, I would use full. I mean, that's something I would absolutely use full dose for, 120 milligrams.
Okay. And let me do a couple, and I do know that you have to go. And ladies and gentlemen, I know you have a lot of questions that are coming here. A lot of them aren't for talking about cancer. So I do see a lot of diabetic neuropathy. It does help with diabetic neuropathy, Joanne. We have a lot of fibromyalgia questions, a lot of Alzheimer's questions. I don't want to say cannabis is a one size. I always say, one of my favorite slides when I speak at cancer events, I'll show a picture of a roll of duct tape, and I don't want to say it's like duct tape with 1,000,001 uses, but really it is. You can go to my site, unitedpatientsgroup.com. Go to the patient's room and health conditions, and you'll see a list of it. We don't have every single health condition up there, but there's a lot, and it'll cover fibromyalgia, Alzheimer's, glaucoma, diabetes, neuropathy, cancer, of course. And so, so it's a free website. But let me get a question here. And I know you have to go to your family here too. This is a patient that's asked, what is the best immediate way to help high blood pressure brought on, and actually this is someone down your way in the Malibu area. What is the best immediate way to help high blood pressure brought on by current fire evacuation crisis? 50-year-old female, healthy woman, 130 pounds, on Levoxo. It's a thyroid medicine.
Voxel.
No, Levothyroxine. And on Lostrin birth control. Her blood pressure today was 106/104. And she's thinking about, and actually it's one of your patients.
106/104?
106/104 today.
That's impossible.
Really?
That's not compatible with life.
Okay, she's your patient, so I'm going to have her
call the office.
Okay.
Yeah, but the blood pressure was checked wrong. The machine was broken. A blood pressure of 106/104.
My apology. It was a misprint. 160/104.
Much different.
Still high.
Still high, but CBD definitely lowers blood pressure. I used to be on a blood pressure medication, and I started getting dizzy because my pressure was too low, had to stop it. But in the patients where I've seen substantial blood pressure drops with CBD, it usually takes a few months. So I think if somebody's evacuating from the fires and they've got an elevated blood pressure, this is something that I would deal with their local doctor, not start a new cannabis regimen for blood pressure after going through the stress you've gone through. I mean, CBD would be great for the anxiety and the stress, but that blood pressure is not extremely high, but it's pretty high. I would feel very uncomfortable with you just treating that without, I mean, if you're my patient and you're out there, call us and we'll help.
Okay. So, ladies and gentlemen, I love it that you were on with us from the very beginning to the end. And I know there are hundreds and hundreds of other questions here that I have not answered, and I apologize. So if you want to write them down and save it for our part 2, which is December 4th, we will get to these as well. Dr. Frankel can be reached in Santa Monica at Green Bridge Medical. I should memorize your phone number, but if you want to say it.
310-393-0640, and the website's greenbridgemed.com.
310, I'm going to post it, everybody, in your chat thing. 310
393
393
0640.
0640. 393 0640. Boom. And then I put our website up there as unitedpatientsgroup.com. We do have a consultation tab, which Dr. Frankel is on there as well, that you can pick a time and date that best fits your schedule. If you do something like that, we do recommend that you bring another family member on there, and or if your doctor's open to this, they're more than welcome to sit in on the call. I do know a few of these doctors and medical professionals, pharmacists, nurses and doctors want to mirror Dr. Frankel, so you can reach him down there at the 310-393-0640 number. And he is busy, and so I know a lot of people have taken advantage. That's right, huh? Not taking advantage.
I've enjoyed.
Have enjoyed this as well. So, but I thank everybody for being on this call with us tonight. This is the Cancer Masterclass is a little preview of what's to come for our February Masterclass. I want to wish everybody a happy Thanksgiving, a happy, safe Thanksgiving. I want to wish everybody happiness as well as health. And if you're going through cancer, I'm personally dedicating this show and what we do to you, your family members, and to my wife, Corinne. Don't want to get emotional here, but thank you for being here. And if anybody's going through something like this right now, I send a lot of love from my heart and my family, as well as Dr. Frankel as well. And so
I'd like to add one thing in closing. I recently wrote an article that you can check on my blog on hope, the placebo effect, and the endocannabinoid system. Just very quickly, it turns out that hope isn't just some magical thing. It is something that actually has, excuse me, an effect on our endocannabinoid system, which helps not just cancer, but helps a number of diseases. And if you look this up on my website, I have a number of references that show how hope works and how the placebo effect works. There are pills that are being sold with the name placebo on them. And somebody just did a study, which is fascinating, where they gave half of the people a pill that had nothing in it, named placebo, versus nothing. And the placebo worked in 35% more cases. So that's part of the hope thing. Do not ever believe when a doctor tells you you have 3 weeks, 6 weeks. We don't know. And we should never be talking about that. We should be talking about how well you're going to be and that you're going to be in remission. And you need to picture that remission.
Visualize. I mean, I'm a big fan of visualization, and if it works, but if it doesn't work, it will make that transition. You know, I can tell you, Corinne and I had an incredible relationship, and the last 4 months, she was diagnosed June 29th, and she passed away on October 19th, 4 months later. And but I can tell you, it was a beautiful. It was stressful, but it was definitely a beautiful, calm 4 months, because we did visualize, and we had a lot of hope. We did not. You know, cancer doesn't discriminate. So
that's all we have. All of us at all times, we have hope.
Yeah. So anyway, Dr. Frankel, I send you and your kids. Dad, when are you coming home?
You're hitting me from everywhere. I'm sorry.
A lot of love, and everybody listening tonight too. And so I mean that from the bottom of my heart. Good Thanksgiving to you guys, and we'll see you soon. Good night, everyone. Thank you.